What is it? So plantar fascia is a thick kind of fibrous connective tissue. It connects the bottom of your heel bone right the way up to your toes, and it plays quite an important role in kind of how you move and how you walk, and kind of getting about day to day. It provides a support to the arch of the foot and acts as a bit of a shock absorber as well. So plantar fasciitis is the inflammation of the plantar fascia, which can be one of the most common causes of inflammation and pain in the heel. It can affect anyone who's sedentary or even athletic, and it can often be a result of either chronic overload from lifestyle or exercise, or it can just be something that kind of comes on over time with aging. So what are the symptoms of plantar fasciitis? Some of the symptoms are generally severe pain in the morning and after kind of long periods of rest, which can improve with movement, but can also be aggravated by long periods of weight bearing, so kind of standing up for long periods of time. Often when you get a physical examination, say if you come to see us at T4, when we press onto your heel, there's often quite a lot of tenderness in that area. But patients who have plantar fasciitis often have a history of progressive pain on the inside of the heel, close to where the arch starts to form. But it can often radiate kind of around the foot as well, depending on kind of how severe it is as well. It can really be described as a sharp pain when taking the first steps out of bed in the morning, but it tends to decrease the more you're kind of doing activities. Another way that you can tell that you've got plantar fasciitis is if you're kind of flexing your toes back, so stretching out your toes, and you get the pain along the inside arch of your foot and into your heel as well. So the diagram at the side there just shows the kind of common areas of where the pain is when you're getting plantar fasciitis. So what are some of the causes of plantar fasciitis? Generally, it's thought that repetitive overload, so standing for long periods of time or running around a lot, can cause the changes to the plantar fascia, this connective tissue that we were talking about earlier. So it can either be quite acute, which is kind of comes on quite quickly, or chronic, which kind of lasts that little bit longer. It's often kind of caused by overuse, normally due to kind of repetitive stress to it, lots of little micro traumas to the plantar fascia, but it can also be a result from something quick, a quick trauma, a quick injury as well. There are kind of other predisposing factors, risk factors we call them. So some of these can be flat feet, high arches, limited dorsiflexion, which is when you're bringing your toes up towards you, as well as excessive pronation and supination. So as you can see on that diagram there, whether your foot's kind of leaning inwards, which is pronation, or outwards, which is supination. Flat feet can be a big cause of it, generally because it puts a lot of strain onto the plantar fascia. The high arches can cause excessive strain on the heel because the foot doesn't really kind of lean inwards and outwards to kind of absorb the shock. So it puts that kind of excessive strain onto the heel and onto the plantar fascia, which is where you're getting that pain into your heel. You can have kind of tight lower leg muscles. So these are your calf muscles, which can cause the tightness into the plantar fascia by pulling onto it. It can alter how you walk, which then can, again, alter how tight it is pulling, and then therefore the pain that you're getting with it. It can often be associated with runners as well, due to that kind of repetitive movement, running on hard surfaces like the pavements and things like that. But it also can be found a lot in kind of older populations. So aging has a little bit to do with it sometimes as well. Some other little risk factors that there are as well is obesity or heel pad atrophy, which is the kind of soft shock absorber of your heel. If that starts to decay, you've not got that kind of protection into the bottom of your foot, onto the arch or anything like that. So if that's kind of atrophied, which is kind of degenerated away, you've not got that extra bit of support into your heel, which can then again predispose you to having plantar fasciitis. It can be kind of due to having an occupation where you stood up on your feet all the time, just because of this progressive degeneration, which is what you kind of get with the plantar fasciitis. So the main thing is what can be done about it. So there's multiple different treatments that you can do. So ranging from kind of ice, painkillers like anti-inflammatories, which is the NSAID, so it's non-steroidal anti-inflammatory drugs, stretching, steroid injection, shockwave therapy, physiotherapy, and custom orthotics. Studies have shown that generally non-invasive methods, so the physiotherapy, the orthotics, the shockwave, the painkillers, and the ice, are the kind of more effective methods at providing a long-term pain relief, but it can take time to kind of show these improvements. Generally, relative rest from the activity, which can be guided by the pain. So we're not saying, you know, stop doing what you love doing, your activities or anything like that, but managing the amount that you're doing. So managing the load that you're doing these activities. This can help to minimize some of the inflammation, which is causing some of that pain into your plantar fascia. But obviously, we never want to tell you to stop doing what you love doing as well. Making sure that you ice after the activity can help with controlling the pain and inflammation, as well as oral or topical anti-inflammatories like your Ibuleave gels, kind of anti-inflammatory Voltarol gels like that as well. They can help by alleviating the pain a little bit more. So anti-inflammatories work by reducing the pain, by kind of stopping the pain pathway and suppressing that inflammation, which in turn helps to kind of decrease that pain a little bit more as well. These can often provide that short-term relief, but really what you're wanting is something that's going to last that bit longer, really. You know, using the anti-inflammatories can help in the short term to get you moving a little bit better and stretching a little bit easier. So then in the long run can kind of do you favors, but you don't want to rely on it is the main thing, really. So how orthotics can help you. Here at T4, we have a 3D printer, which prints these lovely insoles that are on the picture on the side for us. And we get these by scanning your feet and sending them off, getting the code in. They send it back to us, and we then print them out. But how they help with plantar fasciitis. So when walking, your plantar fascia is kind of at maximal tension when you're kind of in the later stage of walking. So when the biggest stress is right near to the heel. So orthotics can help with reducing the heel rise and the Achilles tendon from stretching too much during gait, so which is walking. So this helps with pain reduction. Also can help as a shock absorber. So where they've kind of got the support around your heel, that helps with where possibly with that heel pad atrophy, we've got that bit of extra support into your heel. But also if you have any kind of flat-footedness, they help keep your foot in that kind of neutral position. They'll keep your plantar fascia at a better kind of angle, better position, better way for you to kind of walk again. They have been shown to kind of reduce pain and improve the function. And it is one of the main things that we kind of suggest with plantar fasciitis, just to help with supporting the feet more, getting them into that better position, as well as comfort is the other thing. They help in supporting the feet, keeping it in a neutral position as well. And then physiotherapy. Obviously, could go on and on all day about every single thing we can do, but a few things that physiotherapy are kind of good for doing, especially with plantar fasciitis, is helping to reduce the pain using guided stretches, supervised strength exercises, and providing an additional point of contact for patients throughout their kind of recovery process. So here at T4 Physio, we obviously have the clinics in Bolton, but we have the gym over at Bury, which is good for building up that strength, obviously guided by your pain and the patient's pain throughout. But it's important to be building up the strength, building up the flexibility within the lower leg, within the feet, to ensure that although we're getting on top of the symptoms, we want to manage it for in the future. We want to ensure that you're not going to be struggling with this again. We want to ensure that if you do end up where you're struggling with it again, you know exactly what to be doing in the gym, at home, with your own kind of running training or anything like that. So it is important that we can do all of these different types of exercises as well as the hands-on therapy. So things like the manual therapy, including kind of the joint mobilizations, possibly to help your ankle move a little bit more, some kind of massage into the arches of your feet to help relax the muscle a little bit more and help it stretch that little bit more, as well as stretching into your lower legs. This is going to be really important for you to kind of keep up once physio is done, which is why adherence is kind of the key to success, because keeping up with the exercises and making sure that you're keeping on top of your stretching, your mobility, and all the kind of exercises we've been giving you is the only way that you're going to kind of keep up the differences that you're feeling, reducing the pain as well. So why not get booked in at T4 Physio? We do free 15-minute assessment. We can have a look at you, have a chat about your plantar fasciitis, see what we recommend for you. I've popped a link there just below that you can click on, and I'll pop it into the chat box as well. So you can have a click onto it and get booked in with us, and we can have a look at your problems or anything like that. And if anyone has any questions, feel free to pop them into the chat box as well.